Healthcare. What changes? What doesn't? Who benefits and who pays? The cost of reform and the cost of doing nothing. No noise, just answers.
And how much is it going to cost my kids?
Plus, liberals appalled by a deal between the White House and the drug companies. A former member of President Clinton's cabinet tells us why. Get ready. It's time to talk your money. Welcome to Your Money. I'm Christine Romans. Ali Velshi is off this week. It's make or break month for healthcare reform. What happens will affect virtually every American. There are thousands of pages of legislation, competing proposals, and nothing is set in stone. Let's bring in our CNN senior political analyst, David Gergen, and Andrew Rubin. He's the host of SiriusXM's Dr. Radio. David, let's start with you. You say the odds now of failure are rising a little bit every day. Why?
Well, Christine, these last few weeks have been cruel for health care reform because we've seen a definite falling off, a fading of some of the support for President Obama's health care reform, and a growing resistance expressed in these town hall meetings. And I think it's changing the political mindset, the psychology of Congress. It's very clear that Republicans are going to be much more resistant to a big bipartisan deal than they were only 4 weeks ago. It's going to be left up to the Democrats increasingly, but among the Democrats, there's a real falling out now that's going on over important elements of the health care plan.
Most notably, the public option, which was, we thought, a hallmark of this whole thing, right? I mean, a week now of this controversy of will they or won't they, and how crucial and critical is the public option. Where does that stand?
We've reached a point now where moderates and liberals are getting so worked up over this that it may be very hard to find a solution. In the House of Representatives, there is a very large liberal bloc that's now saying, if you don't put the public option in the plan, we're voting against it. We're going to vote against health care reform. And over in the Senate side, Democrats are saying, if you do put a public option in the health care reform plan, it will fail in the Senate. So that's the makings of a failure. And the president, when they come back from vacation, I think is going to have to haul Democrats in, sit down, and be very forceful to working out a deal that everybody can live with. Otherwise, he does risk failure.
And the politics of all of this so critical, and what David is talking about here is the politics. Meanwhile, on the street, around the country, people are trying to figure out individually what this reform that isn't even written yet would mean for them. Listen to William from Baltimore.
I'm a veteran, and I'm also a retired federal civilian employee. Mm-hmm. So I have access to two healthcare systems. Mm-hmm. What I really want to know is how any proposed healthcare legislation may affect or impact federal employee retirees.
That was a caller this week on a radio show here at CNN that I hosted for Ali Velshi, and he wants to know what this means. We hear it over and over again, specifically for this issue. There are 1.84 million federal retirees. What happens for them?
Well, first, everybody wants to know what it means to them, and It's hard to get an answer. On this one, it's pretty straightforward. On the VA side, the Veterans Administration side, there was some confusion in the beginning. They quickly came out and said there's going to be no changes to the veterans benefits plans. On the federal employees side, it's both retirees and federal employees. Listen, the federal government's like any other employer. So I don't think you're going to see any changes, and my favorite expression, the devil's going to be in the details, but certainly the federal government has the ability to change the plan design once, if whatever legislation comes out. Although I see the rest of the country migrating more towards what's in the federal plan as opposed to the other direction.
So you host a radio show too, and you've been hearing a lot from callers who want to know what's in it for them and what's going to happen for them. Some of these questions we simply can't answer right now, but what's the number one thing you're hearing from people?
Number one question, unequivocally, is if I like my insurance now, and I'm summarizing all these calls, what does it mean for me in the future? Can I keep my benefits? The answer is maybe. So in the short term, if you work for a large employer, you're going to be able to keep your benefits as they are, assuming your employer wants to provide those same benefit packages. However, the legislation is written with time limits, and after a certain amount of time, if your employer's plan does not meet the criteria that's needed for this whatever benefit package the federal government puts together, then the plan becomes disqualified and people's benefits will change.
I was talking to health economists this week trying to find out who has the most to gain, who has the least to gain. People who have pre-existing conditions today, people who don't have insurance today are the early gainers. People who have their own health insurance right now through their company could see their co-pays vary and change. And generally, health economists told me that people who buy their own insurance could see prices go down, could see their costs go down. Is that in a nutshell what the broad brushstrokes are right now? now, or you're going to tell me, well, Christine, maybe, aren't you?
I'm going to tell you maybe. It really depends on what legislation finally comes out and whether there's a federal, governmental plan, or if there's not a governmental plan, and then what's designed into these packages. What I can tell you is we all have a lot of stake in this game. The largest percentage of the uninsured are actually young Americans.
Right.
They have a huge piece at stake, and yet we're not hearing much from them, and they're actually the ones who are going to pay for a big chunk of this.
David, let me ask you, there are a lot of people, when you hear people talking and asking questions about healthcare reform, who are afraid about what they're going to have to give up and who they're going to be supporting. The myths about what is in these bills. One is that illegal immigrants will be granted insurance coverage paid for by taxpayers. What's the truth?
Well, there are a number of myths, but one of them is that illegal immigrants will be covered by insurance. The president has given flat-out promises that illegal immigrants will not be covered by this insurance. There's another myth, which I think is about abortion. The government is going to be paying for a lot of abortions. Christine, as you know, there's more confusion over that issue as to where this is ultimately going to come out. The third myth is that government is going to take over health care in this country. I think it's way too early to say that the government's going to take over. I don't think that's in this bill at all. Are we on a trend line in that direction? That's a more interesting debate. And finally, there's the myth, and I think this is a myth, that this bill is somehow going to lead to euthanasia, that there's going to be death panels, so to speak, that can tell an old person when or she, if they're going to pull the plug on grandma, to use the phrase that's out there. And I think there's everything about this bill says we're not going there. That's not what this bill is about. That, in fact, all this is about end-of-life counseling. That wasn't a bill, and even that's being dropped. I do think the day may be coming when there's going to be a lot more talk in the culture about how long one should live at the end of life and whether one really wants to be in a vegetative state and voluntarily give that up as in a living will, which a lot of people already do.
Yeah, but when you have politics and fear and uncertainty, then all of these things become very charged, and that's how these myths and real fear spreads when you're talking about such an epic undertaking as healthcare reform. David Gergen, CNN political analyst, thank you so much.
Thank you,
also,
Kristen.
Andrew Rubin, Vice President of Clinical Affairs at NYU Medical Center, also the host of Sirius XM Doctor Radio. Thank you so much, both of you. I'll see you again soon, because there's a lot more to talk about. This is, frankly, only the beginning. Getting you the information you need doesn't end when this show is over. You can head to cnn.com/healthcare for answers to your questions, fact checks, mythbusters, and more. So much for a new era in Washington.